Hi, this is Dr. Brian Reagan, a board-certified plastic surgeon, coming to you from the Plastic Surgery Channel. I'd like to talk to you today about all those infomercials you see on TV regarding the amazing new mini facelifts. My advice to you is buyer beware. Buying plastic surgery is not like buying an appliance. We're talking about your face, and you can't simply throw away a bad purchase and buy another. Clever marketing is here to stay regarding the selling of plastic surgery, so here's a list of do's and don'ts that should help you make your decision. First, the don'ts. Don't believe everything you see in those commercials. They claim these techniques are new and revolutionary, and they are neither. The lifestyle lift is simply a facelift and sometimes the neck under local anesthesia while you sit in a chair. The quick lift is a type of facelift that uses a stitch or two to lift the face in a more vertical direction. While this is less surgery and easier for the surgeon to perform, the scars are often longer and placed in a more visible spot. These campaigns involve either a doctor paying a large amount of money to be the local exclusive expert, or they are a doctor for hire who is paid very little per case but is promised large volumes of patients. A second don't. Don't be swayed by a fancy procedure name. Don't let price be the determining factor on who you choose to perform your surgery. You don't have to go to the most expensive person to get good service, but if the person is much lower than everybody else, then you might realize that the adage, "you get what you buy," may be in play. Don't be pressured into paying immediately to reserve your spot. If you feel pressured, leave. Don't agree to a surgical procedure without consulting with other board-certified plastic surgeons. Now the do's. Do your homework. Look into the credentials of your surgeon. As surgeons, we know that the most important decision you will make is who you choose to do your surgery. While many doctors claim themselves as cosmetic experts, know that a board-certified plastic surgeon has done extensive training to develop the skills and judgment to perform your surgery correctly. And a plastic surgeon who is a member of ASAPS, or the American Society of Aesthetic Plastic Surgery, has a particular focus on cosmetic surgery. Do learn what the limitations of a mini facelift are. They're not sufficient for many patients. If a doctor only performs a mini facelift, then he's not capable of giving you an honest consultation on what you may need. Do get a few opinions. I recommend 3. Look for plastic surgeons who are members of the American Society of Aesthetic Plastic Surgeons, or ASAPS. Do ask to speak with previous patients. If the doctor performs great service, his patients should be happy to do this. Remember, we're talking about something very dear to you, your face. So choose wisely. This is Dr. Brian Reagan, and this is the Plastic Surgery Channel.